Welcome back to the Big Ranch Show. Thank you for joining me. Now, today we're going to talk about that gift that nobody wanted from back in 2020, COVID-19. Yeah, it's back in the news today, and we got a little bit to talk about. Now, I'm going to start off by saying that yes, COVID is better than it was. The infections are down. The number of people getting it have come down considerably. We're actually at some of the lowest numbers since the pandemic began. So things are looking great. So I want to give you that positivity up front, because things are doing better than they were. Not as many people are getting it. Not as many people are dying from it. And I think that's absolutely wonderful. And there are reasons for that. Between people getting vaccinated, more people with natural immunity, fewer people are getting the virus. Of course, that brings us to the new variants that are out that have put COVID-19 back in the spotlight. They're calling them the FLiRT variants. They're part of the Omicron family of COVID variants. A lot of them are from, based on the JN.1 variant we had a while back that dominated much of 2023. But the numbers are coming down. In April, they were having 8 admissions to the hospital, or to hospitals, per 100,000 people. As of early May, that is down to roughly 1 out of 100,000 people are getting admitted to the hospital. That's a massive difference compared to, say May of 2020, right? We're way down, which is awesome. But we still have to keep it in mind, right? When we go out, keep washing your hands, of course. Wear your mask if you need to, especially if you feel safe doing so, or if you're immunocompromised, for sure. Because one, it can help you a little bit. It may not prevent every opportunity, because there are multiple ways that you can contract a virus, right? But these are all things that we should take into account even during regular flu season, because flu doesn't play either. COVID is more deadly than the flu, as over time we've discovered that 5.7% of people, or at least over last year, from last year, roughly 5.7% of people that got COVID passed away from it. With the flu, it was roughly 4.2%. And people are going to be like, well, what happened to the flu during COVID? Why did it go away? It's because we weren't around people so much. The flu isn't as transmissible as COVID has been over the last few years. One, COVID has dominated the landscape. But two, between people that were social distancing from 2020 to 2022, early 2023, the virus just didn't spread that much. That's why COVID was around more, because it takes more. The reason the flu goes around is more people are together. And as we saw more schools come back into, back online for in-person schooling and jobs where people started having to go back into work, the flu shot back up last year. So really, I think these are precautions we should take, not just for COVID-19, but for the flu. And no, is a cloth mask going to be perfect? Is it going to be 100%? No. It never was going to be. And anyone that told you otherwise, was probably wrong. But the fact is, they do help to some extent. It keeps the amount of viral load lower. Therefore, your body has a better chance to fight it off. You're less likely to become infected with lower viral loads as well. But to that, you got those people out there that just act weird about people wearing masks and protecting themselves from viruses. And so that's interesting. But later on in June, they will get together and talk about vaccines for COVID-19 at the Food and Drug Administration. And they will discuss, I guess, the timeline for when to get vaccinated again and when they're going to put out the next vaccinations for COVID-19. I suggest getting the COVID vaccine whenever you can, especially if you're immunocompromised or have other people in your life that are immunocompromised. Because without the vaccines, you could very easily spread it to somebody who can't survive it. So do keep that in mind. But like I said, things are looking up. Even with the potential for some surges in the future, because of these FLiRT variants that are out there that are based on the Omicron variants, they're making up, these new variants, the FLiRT variants, are making up 28% of all infections currently. So they're pretty much taken over the landscape on which variant is the dominant variant. But they're not any worse than they have been. These variants that are currently out there are not creating new symptoms, not creating more severe symptoms or anything like that. They're just simply creating more infections than its the predecessor has been doing as of late. So what is this? What are they saying at the USDA or the Food and Drug Administration and CDC? They're saying that you may still have vaccine, if you have the vaccine last fall, you very possibly still have some immunity to COVID-19 going into the summer where they expect a small surge. Or if you've had it since January, you probably still have immunity going into the summer, and you'll probably be protected over the summer during, at least to a certain extent. Because over time, of course, the vaccine effectiveness wanes, and so does natural immunity. They both fail at a certain point. And of course, just because you have the vaccine or you've recently had it doesn't mean you can't get it again. Right? Just because you have vaccines doesn't mean you're not going to get sick. It just won't be as bad. And I've been trying to tell people that on this channel since it all started. Honestly, it's one of those things I've paid attention to for a good long time now. That's the reason I get so angry sometimes at people that tell me I'm crazy. But being in my situation, being that I am immunocompromised, I am, since at least 2010 with the swine flu outbreak, I have been very focused on pandemic stuff, viral stuff, things like that. I read up on it as much as I can. I watch documentaries over it. And that's the reason I wasn't surprised when this new platform came to market for vaccines. Like just before COVID started, I watched a documentary over people looking for the next big pandemic. And they had talked about the development of an mRNA vaccine, a platform where you could quickly get a vaccine ready for whatever virus it was. That's the reason I wasn't surprised when it came up. That's the reason I had no problem getting them, because they've been testing them for decades. So that's the reason I tried my best during this whole COVID mess to try to keep people calm and try to explain the things that I was seeing, the things I was reading. And sure, I'm sure I got things wrong somewhere down the road. And a lot of people may have too. But you know what? That's the thing about science, right? When you change your opinions, change based on the information you have in front of you. When the information changes, your opinion should change. I mean, that's just being human. But the fact is, it's still here. It's still a threat to some people. But you can make a difference, right? You can get vaccinated. That way people that are around you that may be immunocompromised don't get it, or less likely to get it. I found it very interesting last fall that my wife and I got vaccinated in October. And right around the beginning of November, she decided she was safe to no longer wear a mask at work. Interestingly, within 2 weeks of her deciding not to wear a mask anymore at work, she brought COVID home from work. And she was already worried about herself, but she's also even more worried about me because we didn't know if I'd survive it. Luckily, my lack of immune system may have played a help because I didn't have the inflammation that a lot of other people are having. I didn't have the same fatigue that everybody else had that I knew that had it at that same time. And I felt a little different than a lot of people did. Although I couldn't get a negative test for almost 2.5 weeks, it seemed like. Meanwhile, everybody else I knew, they were getting clean tests within a few days, five days max, most of them. I think my wife was clean after 6, but mine kept testing positive for a good while afterwards. Maybe that's part of my muscular dystrophy and part of my immunocompromised immune system. I do not know. But to everybody out there, I hope you're being safe with this stuff, that you're still taking it seriously, especially if you're immunocompromised or know anyone that is. But that's the news. There's a new variant that's kind of taken over the scene. It's roughly 28% of all current infections. But infections are down to numbers the lowest they've been since the pandemic began. So maybe over the next year or so, maybe COVID will play itself out. Let's hope, right? Until then, stay safe. Have a great day, and I'll see you down the road.